Hi everybody, this is episode 46 of the Daily Knowledge Project. This week I kind of want to focus on shoulder injuries because I see a lot of them in my clinic and they're really common. What I want to talk about today is a shoulder labrum problem. Now the labrum is actually the cartilage inside your shoulder. The job of that cartilage is to cushion and support your shoulder. What happens with a lot of people that have a lot of trauma or overuse or really hard on the shoulder is that cartilage or that labrum gets weaker and it starts to fray and eventually it starts to tear. So a lot of people end up having a labrum problem associated with their shoulder. A lot of times it gets misdiagnosed as what's called impingement, where it kind of gets caught up. A lot of times what I see in the office is labrum problem kind of presents as a painful arc. So as you're moving your arm through the shoulder, moving the shoulder through the motion, you usually kind of get caught and then it feels better and then you get to the top and it's okay. A lot of times what happens is that labrum's getting degenerated and beat up. Shoulder labrum tears are a big problem and they actually don't do too well with conservative care. So if you're over 25 and you're considering a shoulder labrum surgery, what happens is it doesn't actually recover a lot because it doesn't get good blood flow, doesn't get good oxygen. The other problem is actually diagnosing the labrum problem. A lot of times a standard MRI won't actually show it. You need a more special thing called an arthrogram where they actually inject the joint with a dye to help bring that about. So a lot of people get an MRI where it comes back and says they're clean and they don't have a problem, but that labrum problem might have been in there because the MRI didn't pick it up. So shoulder labrum problems are a big deal. They get mismanaged a lot and they can actually cause more problems down the road. So that's my video for today. We'll see you guys tomorrow.